Susie. How are you doing today? My name's Michelle. I'm your CNA. I'm here to brush your teeth. Is this a good time? She says yes. There's your call light. Let me shut the curtain and wash my hands. First thing I want to go ahead and get is a pair of gloves and 2 towels. Bring my table over next to the bed. Now, for this skill, there is a pass or fail. And the pass or fail is asking the resident if they have cuts or sores in their mouth. If they reply with yes, you would stop the skill immediately and get your charge nurse. For testing purposes, you will always be able to brush your resident's teeth. Sit the bed up as far as it goes. Susie, there's your call light. Can I get my supplies out of your drawer? She says, sure. I want to grab an emesis basin. And emesis means the act of vomiting. So this is actually what's considered a vomit basin. We'll get that. Our cup of water, our toothbrush, and our toothpaste. I'm going to cover Miss Susie so we don't get her clothing dirty. And we're going to start with a sip of water. She can drink that first sip to moisten her mouth. Anytime we give a sip of water, we always want to pat the mouth dry. We're now going to wet our toothbrush, apply our toothpaste, and we're going to brush all of the teeth on the left side of her mouth, meaning the top teeth, the bottom teeth, the front, the back. We'll give her a sip of water. She'll spit, and we wipe. We brush all the teeth on the other side of the mouth, top and bottom, front and back. Sip, spit, and wipe. Now we're going to brush her tongue. Sip, spit, and wipe. We're now going to ask her, Miss Susie, would you like to rinse your mouth out anymore? If she says yes, we just give her another sip and wipe her mouth. We're going to go ahead and take her towel off. At testing, the next examiner will not want to use this toothbrush. So we're going to dump the water, place the toothbrush in the cup, and throw this out. I'm going to put my toothpaste away. Roll this up. This will go in the wet hamper. We'll place our table back. Miss Susie, would you like to stay sitting up or lay back down? She said she'd like to stay sitting up. So we're going to bring this to the bathroom and we're going to dump this in the sink. Turn the sink on, dump. Rinse, dump, rinse, dump, rinse, dump. Pat it dry. Spray it with disinfectant and set it on a barrier towel. Remove your gloves and wash your hands. Grab another paper towel, pick this up, throw this one away, and now we can place this back in the drawer. All right, Miss Susie, you have a wonderful day. If there's anything I can do for you, you have your call button. Open the curtain, and we do not have to wash our hands again because we did it in the restroom.